Hi, I'm Andrea Joyner. I'm an OBGYN here at the Hospital of Central Connecticut. I have two guests with me. Magda Shatowska, who is one of our lovely chief residents in OBGYN. And this is Megan Brady, who is one of our PA students on rotation right now. And they're going to help me do a primer on the Baby Friendly Initiative and basically what to expect when we get our visit April 1st and 2nd and the things they will be expecting you to know. So I'm going to give you guys all of this via email, and I'll print it out too. It's basically all the questions and answers that the providers need to know in order to pass the Baby Friendly Initiative visit. And so we're going to start with, this is part one, this is going to be the audit of step 2. And step 2, for those of you who don't know, is referring to step 2 of the Baby Friendly Hospital Initiative, the 10 steps to becoming baby friendly. Step 2 has to do with training all the staff and the skills necessary to implement the policy. And guess what? We are OBGYNs, we are the staff, and so this is stuff that hopefully you already know, but just in case you don't, this is your refresher. So without any further ado, Megan will be our baby friendly representative. Dr. Shatowska here is going to be the unfortunate soul who had a patient in labor and got pulled out of her room to be interviewed for the process. And then I will help interpret some of the questions for you. So go ahead.
Hi there, how are you today?
Good, how are you?
Good, my name's Megan. I'm from the Baby Friendly Initiative. I'm going to ask you a few questions.
Okay.
Do you mind stepping out of that room where you have a patient in labor?
Yeah, I'm fine. They're
All right.
watching her. So.
Okay, great. So first question, why is it important for all women to receive information about the benefits of breastfeeding?
So this is a really basic one. They don't need a whole lot of information, and you know the way I think about it is informed consent. So you really want the patient to be able to make that decision with the right amount of information. So, you know, speak in English about that one.
In English?
Or Polish.
Well, so there's two ways to feed your baby once you give birth. Essentially, you can do formula or breastfeeding, and it's been shown that breastfeeding is beneficial in many ways. Initially, the baby has no immunity, essentially, when babies are born, so you pass along your immunity to the baby through the breast milk. And there's a lot of vitamins, and the breast milk changes pretty much daily based on what the baby needs.
Okay, I'm going to stop you right there, because actually the only part of this question, they'll go into that. But they just want to know why women need the information to make that decision.
Okay.
And really the only thing they're looking for as an answer for that one is to make an informed choice.
To allow,
So I kind of gave you the answer already.
to allow fully informed choice, check.
Okay.
Check, yeah.
So,
Think easy.
okay,
A follow-up question is, why is it important that all pregnant women receive information about the management of breastfeeding?
So this has to, when they speak of management of breastfeeding, they're talking more about the process of it, the technicalities of breastfeeding, and why do I mean, is it not intuitive? Well, we all know it's not, unfortunately. And so the root of this question is, you know, why do we have to teach them how to do it in the hospital before they go home?
well, because not everybody knows exactly what to expect with breastfeeding, exactly how to have your baby latch on, for instance. Some people don't know whether it should hurt, what should not hurt. So just to have them know what's normal, essentially.
To prepare them.
Exactly.
That's the key word, preparation.
Preparation for breastfeeding. Perfect. So
Now, can you name 4 benefits of breastfeeding to moms or to babies?
So there are lots of these. You can name whichever ones you want. We're going to put Magda on the spot. We didn't give her a preview of the questions beforehand. But, you know, we'll see how she does, and then we can pipe in and give her other ones. So.
Okay, so there was, well, I already kind of mentioned some of them. You know, passing along immunity, so immunoglobulins, and it's basically passive immunity through the breast milk. I know this, I just let me think of it.
Okay, she has a placenta brain.
It's residue, placenta, leftover.
It's okay. I can pipe in. So other benefits, so yeah, decreased, there's the immunologic.
Less infections, right?
Fewer infections, right?
Infections
Ear
especially.
infections, definitely. And then as far as like immediately postpartum, it helps with the bonding with mom and baby. And then there are maternal benefits too, which are, can you think of any?
Oh, well, there's the weight loss, but I don't know if you'd call that a benefit.
It certainly is.
There's, well, the bonding
Yep.
bonding is for mom and baby. And
So long-term health, I don't know how to hint at this one, but basically decreased risk of breast and ovarian cancer too. And I just had another one. It's gone. No, I
Well,
can't think
you
of it.
named more than 4.
We named more than 4, so pick your favorite
Check.
4, and that will do. So next question.
Okay. Why is skin to skin important?
I think it strengthens the bond between mom and baby early on, especially in those first moments when baby's born.
So how many are you looking for?
So I'm looking for 3 things, and on my sheet I have 5.
It helps initiate the breastfeeding. It helps
Perfect.
with baby latching on in a natural way.
Great.
For warmth.
Yeah,
Exactly.
temperature
There you
temperature
go.
regulation.
And then does it affect the heartbeat or breathing of the newborn by any chance?
I would imagine that it would calm the baby.
That's all.
Probably.
You got all 5. Keeps the baby warm. It's good when you're starting breastfeeding, for bonding, for calming mother and baby, and to regulate heartbeat and breathing.
Okay.
Great. Now, when should skin to skin be initiated?
Okay, time out. There are 2 scenarios. So break this down into 2 scenarios. You have vaginal births and you have C-sections. So go.
Okay, so for vaginal deliveries, it depends on if everything is okay with the baby in terms of babies come out, the APGARs are okay, the pediatricians, if they're there, are not concerned about baby's breathing or anything. You can do it initially as once the baby comes out, I would say. So even with the cord attached.
Exactly.
Check.
Check, check, check.
And C-sections, I don't get to see that part as much because I'm behind the curtain. I would say similar scenario. I mean, you can't always place the baby on top of mom because you might be
Still working.
kind of impinging on the field a little bit, although I know that some places they've started doing that.
Yeah.
Or we'll try to start doing that. But you just want at least dad and the baby as soon as baby's checked out and everything's okay with the pediatricians.
So I think vague is best on the C-section. We do have some hospitals within our system who are trying to start doing skin to skin during the C-section, which is definitely a possibility, and Baby Friendly is very aware of that. But I think what they're really looking for is a vague answer as soon as the mom is stabilized and can. Whether or not we are doing that now is a whole different issue, but as far as when that's possible, whenever the mom's stable and the baby's stable, the end. Yeah.
Probably in the PACU or in the recovery.
Yeah, here we do it in the recovery room. In theory, it could be done during the C-section. It just kind of depends. If it's a stat C-section, obviously the mom is not awake, and so just when mom and baby are able to and are stable.
Great. Now, how long should skin to skin last in the immediate postpartum period?
I don't know that there's a limit. I don't know. I would say as long as they both want to.
Perfect
Exactly.
answer. Perfect.
There is another scenario.
So if you were to want to stop, think of
You have to go to the bathroom or something.
true. Bathroom is a good time to stop. I guess you could take your baby with you.
Necessary evil.
But skin to skin until after the first feed is the other thing. So
As long as they want.
like if you're doing the skin to skin to try to show those initial hunger cues from the baby, that can take up to an hour, and then you can stop the skin to skin after the first feed, but not before.
Okay.
So
Great. Now, why is correct positioning and attachment important for breastfeeding?
Well, if you don't start breastfeeding the correct way, you can run into problems like weight issues with your baby, or mainly just weight issues. And if you start off breastfeeding incorrectly, then you get into this bad cycle of decreasing your milk supply and not and just going down that road, and then you have to play catch up, and it's very hard to get back into breastfeeding, especially if you are then working soon after.
Yes.
like her. So there are 3 big things that they're looking for here, and you were spot on. There was only one thing, and I don't know how many of the 3 do they want. Do they want all 3?
They want all 3.
All
yes.
3. So milk transfer, absolutely. And then, you want to ensure that the mom has a good milk supply, so just like you were referring to with the going back to work. So milk transfer, milk supply, and then there's also the discomfort. If you have a bad latch, you're more likely to have sore nipples, which could be associated with discontinuation of breastfeeding. So,
Great job. Now, why is it recommended that all breastfeeding mothers are taught to express their milk by hand?
Why is it important?
Mm-hmm.
Well, there's one scenario where, at least just for physicians, it would be important because we have OR cases, and if you're stuck in the OR, or if you're about to just go into the OR, if you can express to relieve your breast milk beforehand, if you don't have enough time to pump, that would be really useful. And also, I just had the other thing in my head. Hold on.
So yeah, preventing engorgement, that's
Yes.
definitely,
Yes.
you
Then
know,
that will decrease drive
Right.
your milk supply.
exactly. Engorgement will ultimately decrease the milk supply. And then there are a few other things. So how many? They want at least 3 of these
3
5. So it may be more effective than pumping. It can help the baby to latch on more easily just because an engorged breast, especially when that milk first comes in, it can pull the tissue kind of taut, and so the baby has a harder time latching on. So if you can express some of that so the mom's not as engorged, it's a little easier for baby to latch.
If you have a blocked duct.
Oh
might
yeah,
it
so
help?
for troubleshooting, you know, if they have a blocked duct, it can help relieve that. You know, if they can hand express, or even while the baby's feeding, you can kind of relieve that blocked duct. And then one of theirs is better to express colostrum. You know, that's one way to remember that is if the baby's kind of groggy and having a hard time latching on and not really interested, one recommendation that people have is to hand express colostrum into the baby's mouth to get it to start showing rooting and other signs of hunger. So I think that's probably where they're going with that question.
So that was needing 3 points, so that was great. And why is it important that mothers with a baby in the NICU are advised to express their milk as soon as possible after they deliver?
So this question is going towards moms separated from babies, so keep that in mind. Moms who cannot be with their babies because the babies are in the NICU, why is it important that they start expressing as soon as possible if they want to breastfeed?
Well, I would say along the lines of wanting to, if you want to continue breastfeeding, if you don't express or if you don't breastfeed initially, then that can also drive your milk supply down. So milk supply would be one, I think.
Check. Stimulate milk supply.
Because that initial, you know, the colostrum has all the important immunoglobulins and everything. So that would be another reason. So that, I don't know, I guess it wouldn't go to waste if you don't pump, but you want to have that
To give
on
to
hand
the baby. Yep, those are the 2 things. Provide colostrum to baby and stimulate milk supply. Now, what about how often mothers with a baby in the NICU should be advised to express their milk? So when they're not with their babies, how often should they be advised?
I would say every 2 to 3 hours, if possible, and then maybe every 4 at night if they don't. I mean, I think initially it's every 2 to 3 hours, and then you can space it out to every 3 to 4.
And so this comes down to basically mimicking the feeding pattern. So rather than focusing on the time intervals, probably a more accurate way to state it would be 6 to 8 times in a 24-hour period, including, and that was such a key point that Magda said, including pumping at night or expressing at night, because if you're only doing it during the day 6 to 8 times during the day and sleeping through the night, you're actually giving the wrong signal to your body that your baby is a little bit older and is sleeping through the night, and it will drive the supply down. So just remember 6 to 8 times to pump during a 24-hour period for moms with babies in the NICU.
Even though all they want to do is sleep.
Even though all they want to do
That's
is
all your
sleep.
body wants to do.
Now the next question is, what is the importance of avoiding giving supplements of formula to breastfed babies unless it is clinically indicated?
That I'm not sure of. Maybe it will, well, they'll gain, I know they gain more weight with the formula and supplementing. And I don't know if that then changes how much if they gain more weight, then maybe they will have less hunger, and so they'll initiate feedings less, and so then, I don't know if it, once again, it goes to
you're on
Vicious
the
cycle.
right track.
Vicious
Yes.
cycle, yep. So
If you're not breastfeeding and you're giving them formula, then your supply might be reduced. That's one. And if your supply is reduced and then you try to breastfeed, you might get frustrated. So mom might lose confidence. And also when you give formula, there's the risk of allergic sensitization. So those are 3 key points, and 2 were required for the check marks.
yeah, and I personally think the allergic sensitization is harder to remember. So if you can, I mean, the milk supply thing, it's a supply and demand. So just remember, if they are getting bottles, they miss out on that one hunger cue from the baby and that chance to get the signal to their body. And then we all see it time and time again. The mom's like, I don't have enough milk, but it's kind of a self-fulfilling prophecy. You supplement, so then they don't get the signal from the baby. The baby's not acting hungry. The baby nurses less, and then they have less of a supply. And so it kind of sabotages that whole effort.
Now, why is rooming in important for breastfeeding when baby stays in the same room as mom?
Well, mom then obviously can hear and the baby cry, and see the baby making all the different hunger signals, like rooting and so, and then obviously mom then gets on baby schedule of feeding.
Keep going.
And let's see, what else?
You're on the right track.
I-
Mom learning feeding cues, which you went over.
And
Would I have a happy baby if I can comfort the baby when they're in my room?
right, that's true.
So
Yeah.
just about
So comforting the
mood.
baby
Yep.
quickly is actually beneficial instead of, initially the baby doesn't have self-coping mechanisms, so
Sure.
you have to kind of,
And then along the same lines, it enables demand feeding, which also leads to a happy baby. And this you said in other words, baby learns to recognize its mother. So those are 4 things and 3 were needed for the question about rooming in. Now, why is demand feeding, speaking of demand feeding, important for successful breastfeeding
you mean rather than feeding the baby
on a
clock?
schedule? Yeah.
Well, I would think that it gives, essentially the body's going to tell you what the body needs. So when babies obviously can't communicate to us, so they can't say they're hungry. So I would think that basically they'll get as much as they need when they need it, and
Exactly.
give that same signal to the body to make as much of a, increased fat in breast milk or whatnot, and depending on how much they need for.
Exactly.
They'll go through growth spurts and everything. So.
And then benefits to the mom are also prevention of engorgement and ensuring a good milk supply, in addition to a content baby because of the reasons that you stated. So again, that was a question where 2 points were needed, 2 of those things. Great. Next one is, why should artificial nipples or pacifiers be avoided during the establishment of breastfeeding?
This one I'm not clear on because I've heard different things about nipple confusion. I've heard that it does happen, it doesn't happen, and so, and also I don't know how long it is that you have to give the pacifier for it to make a difference. But I would say you don't want to, I would imagine you don't want to do it before they even start to breastfeed because then they won't,
I think that's very valid. We all hear different things and we all have different beliefs on this. And the important thing for the baby-friendly visit is one of the steps is getting rid of artificial nipples and pacifiers. So they're not going to want to hear you say, well, it's not proven. I think stick with the easiest thing. Stick with the answer to the question, why, they're telling you why should they be avoided. So why should they be avoided? If you think about, there are a couple different reasons. The baby's latch. So if you look at a nipple of a pacifier or a nipple of a bottle and compare it to an anatomical nipple, they're much more pointed and they're more firm, and so the baby has to kind of pucker up a lot more and put a lot more pressure to keep that nipple in their mouth. And so it can actually cause discomfort in the mom and cause sucking blisters because they'll learn, when they're learning how to do this, it's the first time the baby's done this too, they learn to suck harder. And so it can actually cause more discomfort in the mom, more likely to discontinue. So it's much better to establish the milk supply with either the breast, and if the baby really isn't latching on, we have other options, cup feeding, which we do here, the SNS, so that the baby learns on the mom and not on the nipple. And then the other thing is the demand feeding. So I'm sure some of you have seen where they keep jamming the pacifier in the mouth to keep the baby quiet, because the baby keeps sucking, and clearly the baby wants to suck, but at this stage, at least in their intrapartum stay, when they're here on the postpartum unit and they're trying to do that, the baby is not sucking a pacifier just like they would be at 4 months old just to calm themselves. They are stimulating that supply in the mom, and so it's really crucial that the mom answers to every demand that the baby gives. So if the baby's showing hunger cues, if the mom gives a pacifier or an artificial nipple, the baby will suck on that, may miss a feeding, and then you end up with an angry, crying, frustrated baby if it's a pacifier, who then has a hard time latching on because they've learned on the pacifier. And then the mom's milk supply also goes down. So it interferes with this whole process of just trying to get the breastfeeding initiated. And then a bottle in the same way, it's a different kind of nipple. They are getting milk transfer, but they may become used to, the bottle does not require a letdown reflex, and so they may become used to it and get frustrated more at the breast. So if a mom's trying to get breastfeeding to work, a frustrated baby does not help the situation at all. So those are 2 ways that it can interfere.
Now, as the baby-friendly initiative lady, I'm wondering if you and your colleagues teach mothers how to position and attach their babies for breastfeeding?
Well, prior to having a baby, I didn't really know very much about it. So no, I have not been teaching them yet.
Okay, time out. We would like you to say yes, and we're going to give you the tutorial right now to show you, just in case you missed this tidbit of information. So, because the next question is, can you describe how you would teach a mother? So let's really quickly, let me get my baby. Let me turn this thing off. Hold on. Okay.
So this is, so basically we want to teach without them even asking, or if they ask, is this like similar to how our nurses on postpartum say, you make sure this is your fundus and this is what it feels like, and you want to make sure it stays hard, and call me if you have bleeding, things like that. So is this?
I mean, for any mom who wants to breastfeed at all, you should be able to advise them. So this obviously, we even asked the lactation consultants, we're like, do the OB providers really need to know this? But they will ask you this. So we're expected to know it. I mean, whether or not you actually practice this is a whole different thing. But if you were to come in a patient's room and she said, help me, I can't figure out my hold, they expect you to know the different holds. You should be able to list off the holds.
Because my reply previously would have been, we do have lactation consultants here.
Yeah.
Yes.
Let me get them for you.
Right.
Which I think is very honest in a lot of our
and
answers.
is baby friendly, but I
Yeah,
want to be able to check this
So
out.
we need to check it off. So Magda is going to show us the holds first. So there are really, I guess, 4 main ones that what's your favorite hold? Go ahead.
So it used to be the football hold.
Football hold. That's a great one for
This
new
baby
moms.
is gigantic.
It's a huge macrosomach baby. So football hold.
So usually the baby is, comfortably.
Yeah.
Sometimes can fit.
Turn your
on
body
your
this way
shoulder.
so they can see. You want to have like a horizontal line with the baby. You don't want to kink the baby's neck in like this. That's the temptation for new moms, is you kind of bring the baby to the breast like that. You want to bring the whole body and keep the baby aligned. And then, and the whole theory behind that is, like, if you turn your head down like this, you can't really open your mouth to get a good latch, and so a baby can't either. So you want to make sure their neck is in a nice neutral position, and you do that with pillows underneath. And then we'll go through the holds, and then we'll go through the latch. So there's cradle. Can you do cradle?
Yes, I get confused with cradle and cross cradle. So
That's cradle.
Okay.
Yep. So cradle is like what you see in the movies and on
And
TV.
you can do, I don't know, usually I'll move the arm,
With the arm around
somewhere.
the other.
Because the arms do get in the way.
Yeah, you want their arms to be like this and not like, in front of their
usually
face.
the arms,
Babies
or
always
at
want to
least
do that.
for
Yeah.
my baby, the arms are like here.
Exactly.
She has her hands in front of her face.
And you gotta move that arm.
And especially when she's more hungry than,
Yeah.
if she goes to.
They start doing this.
So,
Cross cradle is the same thing, except it's the opposite hand supporting the baby's head, and then this hand supporting your breast in a C hold.
Yeah, so
Okay?
this is the one you can use if you're trying to compress your breast while feeding.
Exactly, like if you have a
need
plug
to-
duct
yeah.
or something like that, you can use this hand to hand express. And also if you're trying to get interest from the baby and they're having trouble, they're not really showing hunger signs, you can express colostrum on the baby's mouth.
It gives you more control with the breast and.
Exactly. So, and then there's side lying, which I'm not going to make you do.
Yeah.
Basically, it's like
Picture.
baby laying on the bed. This is called the resident hold.
Yes,
The resident passes out with the baby. Of course, we don't let them do that in the hospital. But, the side lie can be great for C-section moms because they're not having to sit up. They can be laying down and then help guide this breast into the baby's mouth. And then actually there's one more. I don't know, I call it the C-section hold, but it's a more natural hold. And it's really just like reclined back, like so. And the baby right in the middle, just like nature intended. And then they kind of do the little crawl off to the side.
Oh, so that's a hold.
So that is another hold. It seems, usually it's people who are just relaxing, but then if you notice, the baby just kind of migrates right over. And it's great for people who have abdominal incisions. So those are the holds that you want to make sure you can, talk to your patients about. As far as a latch, what you're looking for is, I think most of you know this, you're going to want a nice open mouth on the baby, and I talked about the chin down. You don't want it right on the nipple. Let's see if I can, you're going to want the areola, or, at least to get these ducts into the baby's mouth so they can express that way. Nose to nipple, a lot of people worry about the baby suffocating. Not the case. They can kind of turn and they do just fine. That's how it's intended to be. And then, what else do they need to know? I don't want to give you too much information to confuse you. So, and then the way you know it's a good latch, you can hear the clicking sound, you can see the baby sucking, you can even hear swallowing, so that's a good sign. It shouldn't hurt throughout the whole feeding. hurting at the beginning is normal because I heard this great analogy that it's kind of like putting your flip-flops on in the summertime the first time. You're so excited to wear them, they're the most comfortable shoes ever. However, the first day of summer, they rub between your toes really badly. And until you get those calluses build up and get used to it, it's really going to kill the first few times you put them on. But by the end, they're the most comfortable things ever. Same thing with the nipple. Your nipple has never been through something like that, or maybe it has, whatever. But you know, it takes a little getting used to, and so that initial latch can hurt, but it should not hurt through the whole thing. And if it hurts, then it's probably a bad latch. Did I hit them all?
Everything. Yep. So the 4 key points, as they just reviewed: position of the mother, position of the baby, how the baby actually attaches, and the signs of the attachment.
Yes. Baby and mother should be comfortable. So that's the other thing. You don't want the mom leaning over and balancing and looking crazy uncomfortable. So pillows can really be helpful with that. So it's really 3 main things: is comfort of mom, comfort of baby, and milk transfer. And then, you know, you are aware of all these different positions and how the baby should actually be latched onto the breast. So, all right.
Now, another thing I'm interested in learning as the Baby Friendly Initiative lady, do you teach mothers at this institution how to hand express breast milk?
Well, like I said before, no, I did not even know how to hand express breast milk until I had my own baby, so not something I used to teach moms.
But for Baby Friendly, you will answer yes. Well, maybe you don't teach them personally, but you could instruct them on how to. And I think that's totally fine too. And we're going to show you how to do that right now. And I actually have a link for you if you still need a visual, because I'm not going to make Magda do it right in front of you. We have our fake breast. Basically, and I was the same way. I didn't know how to do this either, but you're going to want to press in, you know, so you want to go about 1 inch back from the nipple, press in on the glands, compress, and then release. You don't want to kind of slide down like a cow. It's not like that. It's press, compress, release, and then you do it in different quadrants. And of note before that, you kind of prepare the breast for the expression. So you want to get warm compresses around the breast to try to get the milk letdown reflex. And then it's very simple. Just kind of go around and you want to just compress those ducts right there. Press, compress it together, and release. And so the link that if you want to watch a really good video, it's www.newborns.stanford.edu/breastfeeding/handexpression.html. So look that up if you need more instruction. Otherwise, you can stick with our little instruction manual here. Did I get everything?
You did.
So without sliding along the skin, for some reason they have boldface that, so do not say that you're sliding it out like so. Don't do that. It's press, compress, release.
That's all my questions.
All right.
Thank you so much.
So that's the end of part 1.